My name is John Sim. I'm a nephrologist and a clinical researcher at Kaiser Permanente, Southern California, Los Angeles Medical Center. I am the lead author of the upcoming manuscript in the Mayo Clinic Proceedings titled Characteristics of Resistant Hypertension in a Large Ethnically Diverse Hypertension Population of an Integrated Health System. We performed a cross-sectional study in the period 2006 to 2007 within our hypertension population, which accounted for about over 470,000 individuals with hypertension. And based on our criteria of 3 medicines or more with hypertension, which is uncontrolled, or those requiring 4 antihypertensive medications, we identified the rate of resistant hypertension. And furthermore, we tried to characterize this population in terms of demographics and comorbidities. What we found was that within a population of over 470,000 individuals with hypertension, about 12.8% of that population met the criteria for resistant hypertension. And among treated hypertensive individuals, 15.3% of that population met the criteria for resistant hypertension. Furthermore, if we looked at the entire population, we found that there were 7.9% of the hypertension population required 3 or more medications, but despite that, did not have their hypertension controlled. I think our study findings really make us be more vigilant, or maybe sometimes perhaps rethink our hypertension management strategies, at least for a good proportion of the population. What we found was that there was a certain population who were resistant to our current treatment strategies, meaning they required at least 3 or more medications. And these individuals were more likely to be older, male, black race, and have obesity. In addition, they were more likely to have comorbidities such as chronic kidney disease, heart disease. So I think it's in this type of these type of individuals. We need to be a little bit more vigilant in terms of either working them up for possibly other secondary etiologies of hypertension, and then secondly, rethink our strategies in terms of how to manage them medically. Well, hypertension is extremely important and it's extremely prevalent. The rate of hypertension is estimated at 70 million in the United States and 1 million people worldwide. And it's a leading cause of cardiovascular disease, stroke, kidney disease, and death all over the world. So it's extremely important that we're able to treat and, more importantly, manage and control hypertension. What we found is that a good proportion of people who have hypertension, despite our current treatment strategies, are resistant and have a difficult time getting their blood pressures controlled. I think for the patients, this means that not only they have to be more vigilant about their own lifestyles in terms of risk factors to control hypertension, but also to be more engaged in a partnership with their physicians in terms of finding the effective strategies, which will include medications to help control their hypertension, especially if they meet this profile of those people who are more likely to have resistant hypertension. I see three steps that we need to take from here. Firstly, we need to evaluate outcomes in the resistant hypertension population. As I mentioned before, hypertension itself is a leading cause of vascular disease and mortality. And we want to compare clinical outcomes, including cardiovascular disease, stroke, kidney disease, and mortality outcomes compared to the general hypertension population. Secondly, we want to evaluate the blood pressures, and if there is, and try to determine what are the ideal blood pressure settings that are associated with the best outcomes in this population, because they are because it is a population living with chronic hypertension, elevated hypertension for a long period of time. It's really unclear where their ideal blood pressure should be. And thirdly, I think we need to reevaluate our hypertension management strategies. We've demonstrated that a good proportion, over 10% of our population using our current hypertension management strategies require 3 or more medications, and whether in a certain subpopulation that we need to draft different types of guidelines to more effectively and efficiently manage their blood pressure. That's something that we want to study as we move forward. The takeaway message of the study is that in our current hypertension treatment environment, somewhere between 10 to 15% of the hypertension population will be resistant to our current treatment. And what that speaks to is that there is a subpopulation of people who may require more vigilance in terms of the hypertension management. And then secondly, it also speaks to our current treatment strategies, where we may need to rethink our current treatment strategies for this subpopulation who we may consider as high risk. Now, for the patients, I think for the patients, what this means is that if you have some characteristics that we've identified that are associated with resistant hypertension, it means that you're more likely to have difficult to control hypertension, and you need to be more vigilant about the things that you can do to control hypertension. And you probably need to work more closely with your physician about taking the proper steps to firstly getting your blood pressure under control, and secondly, getting the right medications on board to get your blood pressure under control.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.